Hi, today we are going to learn about schizophrenia. What is schizophrenia? Schizophrenia is one of the most common type of psychotic disorder. Psychotic disorders involve alterations in perceptions in reality. Schizophrenia is most often diagnosed in late adolescence or early adulthood. The disorder equally affects both males and females. However, males seem to have an earlier onset of symptoms. Next, let's look at the causes of schizophrenia. Number 1. Genetics. 2. Environmental factors. 3. Biological alterations in the neurotransmitters like serotonin, dopamine, and glutamate. 4. Changes in brain structure. Let's remember the 4 A's. Patients with schizophrenia are best known for their odd appearance and behavior, which are sometimes summarized by the 4 A's. The 4 A's include affect, autism, association, and ambivalence. Affect is described as flat, blunted, or inappropriate. So if you look at the patient, you will see like there is no reaction in his facial expression. He may be like flat, or sometimes he may have like inappropriate affect. Second is autism. A person with schizophrenia may be preoccupied with self, or he may be in a fantasy world. He's in his own world. Third is association. Loosely joined, unrelated topic. The person with schizophrenia may be talking on different topics, but those topics are not related. So topics just may flow, but those topics are not related. Fourth is ambivalence. Having simultaneous opposing feeling, like he may be happy or he may be sad. Next, let's look at the 4 main symptom groups of schizophrenia, which includes positive symptoms, negative symptoms, cognitive symptoms, and affective symptoms. So let's look at what is positive symptoms. Positive symptoms includes hallucination, delusions, paranoia, bizarre behavior. So let's think like hallucination, delusion, paranoia, all those things comes under positive symptoms. Next is the negative symptoms, which includes absence of interest in hygiene, lack of motivation, inability to experience pleasure. So all negative things like absence of interest, like lack of motivation, etc. comes under negative symptoms. Cognitive symptoms includes changes in memory, thinking, and attention. So let's remember like cognition. Cognition is related to memory, thinking, and attention. Fourth one is affective symptom, like there will not be any expression or emotions. Next, let's look at the drug therapy. Most commonly prescribed drugs are antipsychotic drugs. For example, risperidone, lorazepam, olanzapine, clozapine. The hint here is any drug ending D-O-N-E or any drug ending with pine, P-I-N-E, can be an antipsychotic drug. This can be helpful for the exam. One of the major adverse reactions with some of the antipsychotic drug is neuroleptic malignant syndrome, which includes extreme temperature elevation. The management for neuroleptic malignant syndrome includes discontinue the drug immediately and the interventions to decrease the temperature, bromocriptine for mild reaction, and dantrolene IV for severe reactions. Next, let's look at the nursing interventions. Some of the nursing interventions include provide quiet and supportive environment, Avoid challenging activities that can overwhelm client. Establish trusting relationship with the patient. Should not argue or try to change the delusional thinking of patient. Administer antipsychotic meds and observe for side effect. Assist with activities of daily living. Thank you for watching. If you like the video, please subscribe to the channel to watch more videos. Thank you again.